We live in an era of great technological advancement, an age where scientists and innovators across diverse races and ethnicities continually strive to invent mind-blowing IT-based solutions that would revolutionize the various sectors of their country's economy. Would Nigeria, the most populous black nation, richly endowed with both human and natural resources, be found wanting?
I've seen the power of information technology to bring about new innovations at a cost that will make access to healthcare achievable to the common man. Take for instance, I've looked at trends in Nigeria over the last 10, 15 years, and I see that there's been massive IT deployment in critical sectors of the Nigerian economy. But I noticed that IT has not actually been deployed to the critical health sector in Nigeria.
This is long overdue for our people to access their medical record at any point they need it.
We have acute shortage of doctors and other healthcare professionals in the country.
WHO tells us that we should have one doctor to about 600 patients, but that is not what is obtained in Nigeria.
There are only 40,000 doctors available to attend to a population of 180 million Nigerians.
Currently, we have about one doctor to over 5,000 patients. So our doctors are overworked and our clinics are filled with so many people who may not be attended to when they come for consultation.
Which in the case in other parts of the world, it doesn't really happen that way.
This cohort of doctors we currently have, about 700 leave Nigeria every year in search of greener pastures. 15,000 doctors have left Nigeria in the recent years.
Take a look at the health sector. From policy formulation to implementation, you clearly see that there are huge gaps, there are huge lacunas, and clearly one of the fundamental reasons why there is this huge gap is because of data, i.e. information.
And this is where we are coming in. So we come up with an innovation called MyMedicalBank. MyMedicalBank is designed to be a revolutionary approach to how healthcare information is accessed and managed in Nigeria.
Having a cloud storage system which allows for easy access to patient records would increase the turnover time at every clinic visit, and that is something that MyMedicalBank has come to offer.
People will be given the right treatment when the doctor knows what is their health record either in the past or even in the present.
MyMedicalBank will make it possible for a doctor to securely refer a patient to another doctor, perhaps for second opinion or for a tertiary referral. It will provide a platform to engage in multidisciplinary participation.
And for me, I feel that this is a very good thing coming to us right now.
One of the major limitations of existing solutions is that these solutions are platforms that can only be accessible from a single location.
Quite a number of it we have seen are just working on intranet, but this is cloud-based.
Say for instance, a patient has gone to an hospital, let's just say Yaba Hospital. Even if they have a digital solution, the information is only accessible from that platform, from that hospital. If that same patient were to go to another hospital, say in Kaduna, they would not have access to that information. So one of the things we're trying to do is to break that geographical barrier and to bring the health information into the mobile space that even if a doctor was to go to a patient's house, they can access the information in the house anywhere they go.
And if you ask me, what more? Rather than you seeing people going on, the typical medical tourism, you can actually have access to even doctors outside the shore of this country through the same platform. For a meager amount.
If a doctor were to order for an investigation, say CT scan, X-ray, or any other kind of medical test, it will be possible using this platform for the doctor to request for that investigation. The patient goes to the medical laboratory or diagnosis center. The diagnosis center is able to log into this platform, see what the doctor has ordered for, do the test, upload the results on the platform, and that information can be shared with another clinician who perhaps might be 100 or 1,000 kilometers away from that location. There are three categories of users that will be using this platform. Number one is what I call the individual patients. There are two types of subscriptions for individual Nigerians, individual users. One, there's a free subscription that obviously does not require any payments and is available to anybody.
Then we have a good account that an individual will use, and they have access to all the features available on this platform to keep, save, access their record.
I would love Nigerians to support this movement. I'll call it a movement because it's quite tremendous. You could get an alert on your phone to inform you about your checkup, maybe due in 3 days.
There are about 40,000 registered doctors in Nigeria. Our goal is to bring all of them on board, and this for them to come on board is at no cost to them. So there's a free subscription to any healthcare professional, doctors, nurses, radiologists, physiotherapists, anyone that is a registered healthcare professional.
And so I want to advise anyone out there, if you are thinking health, you need to think MyMedicalBank.
Think MyMedicalBank.
Whenever you think about your health, think about MyMedicalBank.
When you think health, think MMB. Go MMB.